And health has been at the center of national headlines this week after President Trump and the Department of Health and Human Services told pregnant people they should avoid taking Tylenol, saying it might be linked to autism. During the press conference where the new Tylenol guidelines were announced, the president and administration mentioned several studies. Now, I spoke to Dr. Jennifer Braverman, a physician who says some small preliminary studies showed a potential link between acetaminophen and autism, but eventually larger studies came out to test whether or not there was actual causality, including one study that looked at a total of nearly 2.5 million children born throughout 1995 and 2019.
There was one that came out in 2024 that was published in JAMA that looked at sibling pairs, essentially where moms had taken Tylenol in one pregnancy and not another, to see if there was an increased rate of autism in their children in the pregnancies that they had taken Tylenol. And they did not find any link at all between Tylenol use and autism. And so I think that data is really reassuring to us as physicians that, that Tylenol does not cause autism.
Now, she went on to say that while there has been an increase in the number of people being diagnosed with autism over the years, Tylenol use hasn't really increased in pregnancy specifically, so building a strong link between autism and Tylenol usage might be short-sighted. During Trump's announcement Monday, he also said pregnant people should, quote, tough it out before reaching for Tylenol. Dr. Braverman says this statement could be dangerous.
Pregnant women should not be encouraged to just tough out high fevers. That's not safer for their babies or for themselves. That carries significant risk to them and their babies, and Tylenol can potentially mitigate that risk. And I think it's very cruel in a way to say, well, if you weren't strong enough to tough it out, now you've placed your child at risk or caused your child harm in a way that is unfounded and is not supported by the scientific data.
She added that possible newfound adversity to Tylenol could lead to patients not treating pain that can be debilitating mentally and physically. Her advice: get your information from a trusted healthcare provider, not a politician. She says her counseling for patients will continue to be that the medicine remains a safe option when necessary. The FDA is beginning the process to initiate a safety label change to include a warning about the stated autism link.